We've heard a lot of cliches about health. Health is wealth. Prevention is better than cure. I'm sure these are phrases we use in conversations all the time. And then there is this big question: how much did Finance Minister Nirmala Sitharaman give for health in her budget this year? Was it 137% or was it 7%? That is the crux of today's debate. And what is prevention and what is cure? Because a lot of people have raised questions. Last year was COVID. I mean, we're still going through the COVID pandemic year. Our health infrastructure needs a big boost. We must spend more money on hospitals, on laboratories, on ambulances, on ventilators, and whatnot. But why has the Modi government given just 7% to health? But the minister claims it's 137%. What is the truth here? We have Professor Ila Patnaik to discuss this with us. I'm YP Rajesh, managing editor at ThePrint. Ila, 137% and 7%. Uh, and the finance minister talked about prevention and cure. What is getting lost here in this argument?
Now, when we look at the traditional health expenditure, or what was called health expenditure, then it was mainly the expenditure that went through the Ministry of Health, which means it is primarily on curative care. So hospitals, on doctors, nurses, their salaries. Bulk of it is actually salary expenditure, but that is the expenditure for curative care going through the health ministry. Now, if you actually look at the disease burden of India, then there are two characteristics that I want to point out of India's disease burden. So, what is it that determines the health of the people in India at the stage of development that we are? The first most important thing is that we still are a low income country. So per capita incomes are low. There are so many people below the poverty line who have low incomes. Given that it is a low income country where we haven't accumulated a lot of wealth and a lot of public infrastructure like drinking water, sanitation, drainage, urban waste disposal, sewage disposal systems. There is what is often called the traditional burden of disease that a poor country has. Now, this means these are diseases that are related to malnutrition, to open defecation, so diarrhea. We have high infant mortality rates because of the exposure that the malnourished or poor children have to very high uh, mm, E. coli in the water, and so on. So that is the traditional burden of disease, which is largely communicable diseases. So you have diarrhea and so on. Now, the country hasn't yet gotten out of that. So we still have to work on that burden of disease. And I'll come back to that in a bit after defining what are the two kinds of disease burdens. The second kind of disease burden, which we've been seeing increase at quite a fast pace in recent decades, is that of non communicable diseases, diseases that are related to high growth. So, on the one hand, we are a low income country. On the other hand, we are a high growth country. Now, what happens when you have high growth? High growth means you start polluting more. You start polluting your water, you start polluting. So, industrial waste pollution, you have high air pollution, you have urbanization in an unplanned manner. And that gives you, because you are witnessing rapid growth. So, it's well known that India has high air pollution levels. 11 of the most polluted of the 20 top cities in the world are in India. The highest disease burden from any particular source today is because of air pollution. So, this is the second aspect of India's disease burden that comes from high growth. So, what we have to address is not just curative care, which is the hospitals, the doctors, and medicines, and so on, but the second as well as the third. The second is putting in place public goods like drainage, drinking water, and so on. That gives us an ability to reduce things like infant mortality, which come from these traditional disease burden. And the third is the new health risks that are arising from high growth, such as air pollution. So it's really addressing all three that can help us get better outcomes. When people talk about an increase in health expenditure, they've mainly talked about the increase in health expenditure that comes from the Ministry of Health. So, you give a higher allocation to the Ministry of Health, and that's the increase in health expenditure. India has a very large out of pocket expenditure, which is private. So, about one fourth of the total expenditure on health is done through the public system, and three-fourths of it, or 80% of it, the numbers vary, but between 75 to 80% of it are actually often what's called out of pocket expenses, which are private expenditure on health, OPD facilities, when we go to a doctor or when we go to a private doctor and so on. When we spend, then it is households who spend on health. So the way to think about health is that while there is one element of expenditure that is on curative health, there is expenditure that only the government can do, which is on public goods, on preventive health, so which improve health outcomes. So again, it'll both be in the first category, which is those that address the traditional burden of disease, drinking water, sanitation, etc., and in the second category, that is those that prevent air pollution or chemicals polluting industrial wastage or pollution like that. So those are the three things that have to be addressed to get better health outcomes. And what this budget does is that it talks about health and wellness, which is really taking all three together. And so the when it talks about what is the expenditure, I wouldn't go into what is the increase in expenditure, because the increase is non-comparable. Because if you wanted only to talk about health ministry last year and this time to talk about health ministry and urban and rural water, then you can't compare the two. So what you need to, you do need to do the right comparison. But I completely agree that health and wellness has to go together. What affects us is health and wellness. I mean, you give me bad air pollution, it gives me asthma. You can't get brownie points on making more hospitals that will treat the asthma. You get brownie points on reducing the pollution as well.
Mhm. We are talking about health here, and before we move on to the next question, Ila, I want to just take a minute to talk about the health of the print. We need to be healthy. We don't want to get into a curative mode. We want to be in the preventive mode. We want to stay healthy. And how can that be ensured? That can be ensured by viewers such as you taking subscriptions. It's important to pay for what you read and watch, because that ensures a young media organization like the print is healthy. uh, we don't have a conglomerate behind us. We are, a small new organization. Our expenses in bringing you the journalism we do, sending reporters everywhere, producing videos, costs a lot of money. And why should you watch it for free when you pay for everything else you consume? Take a subscription today. The link is just below this video. After the video ends, it will be in the description. Take a subscription. There are monthly plans, there are one-time plans, and you will not regret subscribing to the print. And today's column by Ela on the same topic on prevention and cure is also going to be there in the description. So please do read, please send in your questions. And coming back to our discussion, Ela, this is a change in the traditional thinking. And for some reason, people don't seem to grasp it. A lot of critics have said, despite the pandemic, the government has allocated only 7% more for the ministry. Uh, so, what do you think brought about this change? Because, I mean, immunity is something everybody has talked about during the pandemic, that we need to build better immunity so that we don't get the infection. All these immunity boosters have been marketed. A lot of that, thinking has gone around the commercial space. But How do you think this has changed the thinking of the government?
So this is a debate that has been going on for a long time. When health policy was more doctor driven, and the health expenditure was doctor driven, then what we saw was a much greater focus on curative health. So, you'll hear this very often that India spends only this percent of GDP on health. Indian government budget should spend 6% of GDP on health, or whatever is the expenditure on health that they're recommending, 6 or 10 sometimes. So, you can't blame them. I mean, doctors do focus on curative health. If we go back about 50, 60 years, then the Department of Health also used to have an engineering department. These were state level departments, and they used to have engineering departments. And in the engineering departments, the public works department would be looking at drainage and water and sewage, etc. Slowly over time, the focus of health, that part of the health ministry, or that part of the health establishment, has shriveled away. And what you find is that the health establishment has been increasingly dominated by uh, the medical establishment, which does focus, tend to naturally focuses. They are not the engineers who will make pipes, they are the ones who can build and run hospitals. So they've focused on that. In this debate in the last few years, it has increasingly become clear that you first have not really been able to provide the even the hospital system. And there was a three-tier system. There is even now a three-tier system in the Indian sarkari health system, which is the primary, the middle, and then the secondary and the district hospitals. And this was recommended in 1946 by the Bhore Committee. And all these years, the discussion has been, it is not doing well because we don't give it enough money. So the question has been, put more money into the same system. While the insiders have been those who have been arguing this, there has been a debate, particularly by some very eminent health economists like Jeff Hammer, Jishnu Das, people who have been arguing that now it is, we are ignoring that part of health expenditure where the bang for the buck is the maximum. So you give clean water, the cost of clean water compared to the health outcomes that you get will be actually much better compared to if you first let children get diarrhea and then you give them medicine, build hospitals, give them doctors and medication. I mean, very shockingly, there are studies which say that, oh, it's cheaper to give children antibiotics. So you give them antibiotics, don't waste money on water and sewage. But, I completely disagree with that sort of line. So I find that this emphasis on water sanitation is actually in line with what many economists have been saying, that that's what's going wrong with our health policy.
And Ila, I think we should give credit where it is due. Doesn't matter which party or which government is in power. There has been some progress made in the last few years when it comes to things like reducing open defecation, better sanitation through programs like Swachh Bharat. Now there is a Nal Se Jal program which is trying to provide tap water across the country. The budget also talked about the supplementary nutrition and the Poshan Abhiyan, which goes on to give better nutrition to children. The Ujjwala program, which you've written about in your column, gives cooking gas LPG cylinders to households, and we all know, or it has been at least reported widely, that the smoke women in rural households and even in poor households in the urban areas, the smoke they inhale from their chulhas, as they call them in the north, or you just put firewood and cook, that is seen as one of the biggest contributors to lung cancer. So there has been focus on this, and we must give due credit where it is due.
Absolutely. So, open defecation is one of is very, very highly correlated with children's health, with infant mortality, with stunting, with things that uh, are well known to be bad health outcomes. And open defecation was something that, I mean, maybe the country has tried to deal with, but never gone in such a big way to try to address it. Many people will say, oh, only 50% people are using the toilets that have been built under Swachh Bharat. I would say at least 50%, instead of saying 50% people are not using, because these are behavioral issues. Let's just say that at least 50% people have started using them, and this number will increase, as behavior changes, because these are behavioral issues, these are habit issues. Similarly, the same is the case with the Ujjwala Yojana, where people were given a first cylinder. And again, the criticism is that, oh, but everybody is not able to buy the second cylinder. It is true that everybody is not able to buy the second cylinder, but then there are households that have bought the second cylinder. About maybe I think 30 to 40% in the last study I was seeing, and maybe that number is hoped that that number will increase. It does bring in, I mean, I would say both these things are not only important for women and women's health, very important for children's health, who are the quiet sufferers, whether it is from the open defecation that was prevalent, or whether even the unborn child suffers from the smoke that the mother inhales from indoor pollution. So in some ways, while these were schemes that were meant to give out things to people, beneficiaries that you could easily give out to, there's no denying the fact that these are now you know uh, in measures of standards of living, these are assumed to be very basic things, because they determine your basic nutrition, health outcomes. And they are, I would say, they are part of uh, what I would call health expenditure, because it is improving health outcomes.
I just have one more question from my side, Ila, and then we'll take some questions from the viewers. The last aspect you deal with in your column today is about the health burden that has been or that has emerged from rapid growth. Things like unsafe buildings, unplanned cities, bad drainage and sewerage in our cities, dysfunctional garbage, disposal systems, and all of that. Do you think the budget has sort of tried to focus as much on that as it has on the prevention part?
So I think it's made a beginning on
Mhm.
air pollution by allocating resources to tackling air pollution. That is, of course, not enough. We know the kind of air pollution. We've often talked about the air pollution that we suffer when there is crop burning, and that there are farmers are protesting that they should be allowed to burn crops and to pollute. And the Finance Commission formula is a strange one, where the polluting state gets money. So the more they pollute, the more money they get. So I think there is a lot of work to be done on how we are going to handle these very high health risks that are emerging out of our rapid growth, out of the way we produce, out of our urbanization policies, out of the way we devolve money to cities, and whether the cities have the capacity even to deal with some of the health risks that are emerging. So, the answer to these is not build more hospitals and hire more doctors. The answer to these lies in ministries outside the Ministry of Health. It lies with urban planning, it lies with local governments, where you actually prevent these risks from arising.
We'll take a question from Abhi Thakkar. Thank you, Abhi, for your question. Abhi is asking, why don't we give enough importance to dust in our cities? How to resolve the dust problem, which may be causing many issues from allergies to breathing issues?
I think, Abhik, you're absolutely right that this is a problem. And as I said, we have problems related to high growth. Construction happens when growth happens. The two are very highly correlated. So whether it is dust that emerges from construction of roads or from buildings, urbanization gives you more construction and high dust. Now, one of the things, of course, is the apportionment. So recently, I think Delhi government has decided that they would look at what are the sources of pollution, and they would do this apportionment and then try to address the sources of pollution. Because in the past, we've, without knowing where the pollution is coming from, we've done this odd even schemes and various we come up with initiatives without really knowing what is the percentage of pollution that will go down, that can be attributed to this particular source.
Mhm.
So I completely agree that dust is an issue, and I think if we do studies of levels of pollution and we do apportionment, we will find that when we realize that, okay, dust is so much of a contributor to pollution, just the measurement will actually bring the issue up, to something that will then be able to get resources around it, convince people, convince governments that this has to stop.
In fact, Tila, I think dust is something we Indians take for granted, that we live in an environment where there is so much dust, and we don't treat it as a problem. But I think if people remember when this whole air pollution problem became a big headline in Delhi, especially in the north, in the last few years because of stubble burning, there was a study by IIT Kanpur which said actually the contribution of dust to air pollution in Delhi was almost 30% or 34%, if I recall that. That's one third of your suspended particulate matter, as they call it, came from dust. And if you remember, whenever there is the winter smog or the Diwali pollution problem, the Delhi government bans construction in the NCR area because that is thought to reduce dust contribution of dust to pollution. But these are all band-aids. We don't seem to have a long-term plan to curb dust pollution, although we see some water being sprayed on roadsides to keep the dust on the road, and so that it doesn't, the suspended particulate matter doesn't rise into the air and people don't inhale it. But much more needs to be done, and you're right, Abhi, it's a very serious problem. Kartikeya Gupta asks, what does the grim data of NHFS 5 suggest about the interlinkages between the economy and health?
So, uh, Arvind Subramanian has an article on using NFHS data, where he seems to find that in the last 5 years or 6 years, there has been an increase in stunting. And that means that it has worsened. So I would say that out of the studies that I have looked at, this is indeed worrying. What I would want to do is to look deeper into this, uh, where we should be looking at where is this happening, why is it happening, because otherwise it seems a little odd that you've had a reduction in open defecation and an increase in incomes, and yet stunting has not improved. So that's one of the NFHS studies that I've read about. But I think a lot more needs to be done and understood.
Mhm. There is a question from Rajiv. He says, from the budget to the Prime Minister's speech in Parliament, there has been a signal, or the government has signaled a move as a whole for a new India. Do you think there's a need for change in the polity of local politicians to bring change in our societies? It's a very general kind of a question.
So we should address these all politics questions to Shekhar Gupta.
that, that was very well played, Ila. As they would say in cricket, that's very well left.
No, I wouldn't even venture to start talking about politics and local politics as different from national politics. I mean, this is just not my domain. So I think Shekhar is the best.
So Rajiv, you should watch our other show, very popular, which is called Cut the Clutter, which Shekhar Gupta hosts every day. I'll take the next question from Vadivel. He says, should the government increase its CGHS budget? What is the state of government-supported health insurance schemes?
See, government has been increasing in expenditure on some health insurance schemes like Ayushman Bharat. I have a huge problem with what is happening, and that is that India has the largest unregulated health system. So, if you look at other health systems, what is regulation of the health system, and what is it that we should have before we start putting money in to health insurance? Is that we should at least know that the doctor we go to is qualified, right? You should be able to look up a national register where the you can look up if the doctor is qualified and has not been banned from practicing due to malpractices or mis-selling, or because these days there's a lot of concern whether it is pharmaceutical companies or hospitals, diagnostic centers that push doctors into doing a lot of practices that are unethical. So you don't want to go to a doctor like that. Can you at least check that the doctor is qualified? Can you check that he has not done any obvious malpractices, that there have been not been any cases against him, whether it is of sexual abuse or any other maltreatment? So you need a live register of doctors. Similarly for hospitals, so if you're going to a hospital, regulation of hospitals is in many states comes under the, including in Delhi, under the Shops and Establishments Act. It is more concerned with the size of the waiting room, whether it's air conditioned or not, what is the number of people, rather than something like what is the infection rate. So if you are going to an operation theater where things are not kept carefully and infection rates are very high, secondary infections or hospital related infections, you would not want to go there. So you want to go and have a health system which is well regulated. My problem with the insurance rollout, in fact, we have a paper on this, it's an NIPFP working paper that my colleagues and I have written, where we've traced how first the government tried to make the three-tier health system work, the hospital system work. When it did not work, they started saying, okay, here is money, you can go to private hospitals and we will pay you. So that's health insurance. They started pushing for health insurance. But what the government did not do along with it is to regulate uh, the health system, whether regulate doctors, nurses, paramedical staff, hospitals. So in in this arrangement, as a customer, I don't know what's going on. There is what economists call asymmetric information. I have no idea about how things are being done, whether it is safe or not. And as a customer, to look after my interest, to protect me, a good regulatory system should be put in place. So,
We have time for just one last question from Pratik Sadalge. I hope I pronounced that right, Pratik. Thank you. Do you think measures such as prevention and cure are result of programs like Ayushman Bharat? Uh, Now the Indian government has an obligation to reduce the health risks, just like private insurance companies do.
see, I don't think that health is improved by doing simply doing an Ayushman Bharat. I think if you, Pratik, go back to the beginning of the show, then we're talking about how health outcomes can be improved by doing public goods first and foremost. I mean, yes, insurance schemes also help later when you try to prevent diseases as much as you can, and when you can't, you do go to hospitals. But having a dirty environment, having diseases spreading, or having making roads that are not safe. I mean, road accidents are another thing that come under this issue. When we don't try to do prevention, when public goods are not made in a way that they try to reduce health risks, then the government does health insurance. So health insurance is not a preventive.
Thank you so much, Ela. I want to apologize to Ashish and Kaushal Batavia. We could not take your questions because they were more general economy questions and not related to our conversation. But I promise you, please do ask us a question which is related to our focus of the day, and we will definitely take it the next time. And I'd like to thank everyone else for watching us, and we will be back next week with another live episode of